Today we're going to talk about chest pain in the athlete. So I'm a pediatric cardiologist, and every week in clinic I see several kids who've had referred to my office for chest pain with activity. Now, chest pain and its activity we take very seriously because, as everyone knows, we've all seen the newspaper reports of a kid having a bad event on the basketball court or the football field, which they may or may not have recovered from. So really it's scary for us, it's scary for the coaches, and it's scary for you as a parent. So what do you need to know to keep your kids safe when they're out there playing on the field? First and foremost, a chest pain with athletic sports needs to be evaluated by a cardiologist. We often do an ultrasound of their heart to make sure that their heart muscle is not thin or thick, and we also do an EKG looking for other common findings for chest pain with athletes that could pose risk with them continuing their sports. The other thing to realize is that every year you complete a form that looks at whether or not your kid is at risk for having a bad event. We take these forms very seriously because one of the things that we always find is that a family history is very important in really looking at whether or not a child is at risk or not. So make sure you think about those parents, grandparents, and whether or not they've had significant cardiac disease. And the last thing is, don't be afraid to ask your pediatrician. They're a great resource for you, and always asking the question is always peace of mind. Really, at the end of the day, you have all the tools that you need in order to keep your athletes safe on the court. That's making sure that you talk to your pediatrician, you pay attention to those forms, and you always ask if you have any questions or concerns.